Hey, everybody. Hello, hello. It is Thursday. It is our migraine strategy call day. We are coming live a little bit early today. We normally meet with you at 1:30 Eastern time, but today we're coming to you a little early for a very special training. So I'm just making sure we are all good to go here, getting all the tech out of the way, making sure I can see everyone's comments. So give me a hello. Let me know you are here. Let me know where you're watching from. I am in Rochester, New York, and right now it is decided it is going to, I don't know, sleet, rain. If you look behind me, it looks like it's, 7 o'clock at night outside. It's a little crazy, but anyway, let me know you're here. Hello, Nicole. Hello, Brenda. Hello, Susan. Good to see everybody. Looks like we are streaming live. We are recording. Amazing. I'm just going to give everybody a second to pop on. Hello, Anne. Yes, Brenda's in Colorado. You probably have worse weather than I do. Oh, Shannon. Good to see everybody. Williamsport, Pennsylvania. I know where that is. Not far from me at all. Hello, Marcia. Good morning. Oh, not so sunny today in Florida, huh? That's stinky. Yeah, it's really, I can hear it. You guys probably can't hear it because I have my headphones in, but you can hear it pelting against the house right now. It's just, oh, it's miserable. Hoping tomorrow is going to be a little bit nicer and the weekend. All right. So it is 2 minutes after. I'm sure we're going to have some people popping on because we had quite a large amount of people saying they were going to join today. But I want to get right to it. So if they pop on, which is great. So for those of you who don't know me, my name is Debbie Weidel. I am a certified migraine health coach specialist here to help you find ways to relieve your migraines and actually get to your migraine freedom without having to use these cover-ups, these things that are not actually getting rid of your migraines. The migraines keep coming back. We use the medications, we do the essential oils, we do the ice, we go to the chiropractor, and the migraines keep coming back. So we are here to help you actually get to the root cause of your problem so that you no longer have to do this anymore. So who here right now, who is watching, who has had a migraine in the last week? Let me know below. Just comment migraine if you've had a migraine in the last week, or if you've had any symptoms in relation to a migraine, whether that is brain fog or joint pain or dizziness or gas, bloating, diarrhea, constipation, heartburn, weight gain, any of those things. Who has felt any of that in the last week? I'm sure probably quite a few of you here, except for maybe some of those who are working with us in the Freedom from Migraine method in our private program where we fast track and help people find their migraine freedom. Hey, Jennifer. Yes, Roseanne, good to see you. Oh, sorry, you've had a migraine, Anne, as well. Quite a few of you. Okay. Brenda says an inch of snow on the ground. Oh, but that's pretty. That sounds pretty. Yeah, I would like just a little snow on the ground, not what we have. Okay, so we've got, Roseanne, almost all of it every day. Okay. So that's why you guys are here, right? You're here because you are having migraines and having these symptoms. So whether it's daily or once a month, you haven't been able to find a way to stop them from showing up. As we said, you've been taking the medications that the doctor's prescribing. You're using the ice and heat to help get through the migraine. You've changed your diet, I'm sure, drinking water, changing up your exercise. And some of you have even done surgeries, seen naturopaths, and even gone to the top pain clinics. I can't tell you how many women we have in this group right now that have actually gone to the top pain clinics and are still feeling pain. And again, that's because that medication is working as managing your migraines, not ending your migraines. And I know that so many of you are the best researchers in the face of the world. You spend so much time trying to research to figure out how to get the pain to go away. And maybe you've gotten a little success. You probably feel that roller coaster effect of, ooh, the migraines got a little better. Ooh, they're getting a little worse. Ooh, they're getting a little better. Ooh, they're getting a little worse. And that's typically what happens when we do that research online. and you're really sick and tired of being sick and tired. And this is something that someone said to me the other day in a coaching call. And I thought that would really resonate with so many of you, being just sick and tired of feeling sick and tired, because that's how you're feeling. Even if you don't have a migraine every day, you've got the migraine hangover, you've got the other symptoms that go with the migraine. You just don't feel well. So for those of you that are here, except for my Freedom from Migraine Method ladies, because you know the answer to this. So those women that are not working with us, tell me below, why do you feel like you are still having migraines? What do you think is holding you back? Do you think it's hormones? Do you think it's weather? Do you think you haven't found the right medications yet? Do you think it's the food you're eating? I've got at least 10 or 15 people on right now. So I want to see 10 or 15 answers before, again, except for my Freedom from Migraine Method ladies who I know this answer. But tell me, why do you feel you are still having migraines? And while you're telling me that, and I'll take a look and make sure we wait here for the responses. For me, I always thought it was because it was hereditary. I thought the reason I was getting migraines was because my mother did and my sister did. And there was no way I was going to be able to actually end them, that I was going to have to find a way to manage them because it's genetics, right? You can't change genetics. Well, after 10 years of daily migraines and over a decade migraine free, I'm here to tell you that genetics, it doesn't matter. It does not matter what your family history is. You can beat migraines. So Roseanne says gut issues, even though you change your diet, weather, genetics, barometric pressure, meds. Hey, Valentina, weather, sinus. Okay, so we've got a lot of the same things here and the same reasons that people think that they're getting migraines. So keep plugging in those answers. Keep letting me know as you're popping in, because I know I can see people just popping in very quickly here, trying to catch us. I know a bunch of you are going to try to catch us at work. And for those of you on Pacific Coast, I know this is early, it's 7 in the morning. So while you keep giving me the reasons that you think you're getting migraines, I'm going to tell you the reason that you are. And it's really simple. The reason, the thing behind all of your migraines and all of the other health symptoms that you are feeling is chronic inflammation. Inflammation is now being linked to just about every health condition that there is. Research is finally coming to light in the conventional medicine community, but it's really a slow process and it is being blocked by big pharma. Think about that, because if we know that inflammation is at the root of all chronic illness and we focus on reducing that inflammation, then we no longer need to take medication. Now, typically, when something like this is learned, think back to when the first time you heard the word microbiome, right? Everybody in the conventional medicine community thought that people that use that word were quacks. They thought they were nuts. It took about 10 to 15 years for that knowledge and that research to become commonplace in the conventional medicine world. And now it is a word you hear all the time. You hear conventional doctors constantly talking about your microbiome and the importance of making sure that you have good bacteria versus bad bacteria, and how your microbiome is actually created, in part by your grandparents and your great grandparents. That is something that was huge in the functional medicine space and was never talked about in conventional. Again, doctors were actually let go and lost patients because of talking about things like that. And it's kind of the same right now with inflammation. It has really taken what the functional world has known for 10 to 15 years. It has taken that long for it to start filtrating into conventional medicine, but it is still not where we want it to be. And it amazes me because places like Harvard Medical School, they report that chronic inflammation plays a central role in some of the most challenging diseases of our time, including rheumatoid arthritis, cancer, heart disease, diabetes, Alzheimer's, and asthma. So we know research has been done at Harvard Medical School. We know that chronic inflammation is the cause of those things. Those things don't just show up for no reason. You know, modern medicine or conventional medicine, you know, what probably the majority of you are using right now, you know, you go to your general practitioner, you go to the neurologist, you go to a gastroenterologist. Most of those are focused on treating symptoms, not addressing the root cause of the health issue, which, as we said, is inflammation. According to another scientific article published, and this was a little older one, that was published in 2012, but an increasing body of evidence is showing and continues to show that chronic inflammation causes and advances most common diseases. Now think about this: arthritis, it's inflammation of the joints. Heart disease is inflammation of the arteries. And inflammation is considered a hallmark of cancer. So instead of taking a medication to reduce an inflamed area of the body, the focus must be on reducing inflammation in the first place. You know, taking meds and using whatever we're using, you know, to temporarily cover up pain. Think about it this way: when you take a medication to cover up the pain that your body is giving you to warn you that there's a problem, it is like taking a piece of duct tape and covering up that check engine warning light on your car. I don't want to see it. If I don't have to see it, I don't have to focus on it, right? The car's going to stop working, and so are you. The duct tape doesn't stop the process of the car braking. The medication doesn't stop the process of your body being inflamed. It actually increases the inflammation in your body. Chronic inflammation and inflammatory diseases, they are the most significant cause of death in the world. Now, for those of you who may be sitting here right now saying, I'm full of BS, you know, I'm not making any sense, please remember all these studies that I'm quoting, but all of you know the World Health Organization. I'm sure some of you trust quite a bit of what they say. The World Health Organization ranks chronic disease as the greatest threat to human health. The greatest threat to human health. The prevalence of diseases associated with chronic inflammation, it's anticipated to increase persistently over the next 30 years in the United States. In the year 2000, which, you know, we're talking old data here, nearly 125 million Americans were living with chronic conditions, and 61 million, which is 20% of that, had more than one chronic condition they were living with. In recent estimates, in 2014, nearly 60 million Americans had at least one chronic condition, and 42% of them had nearly more than one, and 12% of adults had 5 or more chronic conditions. Just let that sink in a minute. Let that sink in a minute, how much of an impact inflammation has. Now, we don't have great numbers from 2023, but the last estimate we have is 133 million Americans, which is representing more than 40% of the total US population, is chronically inflamed. 40%. So worldwide, I want you to picture yourself in a room with 5 people, okay? Picture yourself in a room with 5 of your family members. 3 out of those 5 will die due to chronic inflammatory diseases. Things like stroke, chronic respiratory disease, heart disease, cancer, obesity, diabetes. And these are things that people don't need to die of. Want you to stop to think about the fact that migraines are a symptom of chronic inflammation. So if you have migraines, you have chronic inflammation and are at risk to be one of those 3 people out of 5 to die due to your inflammation. So even if you're here today and you are someone, because I hear this all the time, so even if you're here today and you're willing to say, you know what, I'm just going to keep managing my migraines. I've pushed through the pain this long. I can manage to push through the pain. I'm going to find that next medication. My doctor just said I can take a new injection I can do the new injection and I don't have to do anything else, or I can do Botox, or you know what, there's this nerve surgery that people were talking about. And if I do that, then I can go on living my life. Even if you're willing to do those things, are you willing to risk your future health by not taking action on any migraines or headaches that you're having? Because that is your body's way of talking to you and telling you you got a problem. So tell me below right now what you think some of the symptoms are that you're feeling of chronic inflammation. And again, please, the more we interact in this training today, the more you're going to get out of this. So everyone, I'm opening this up to everybody, including my private clients. Tell me what you think are some of the symptoms of chronic inflammation that you're feeling. Are you feeling that brain fog? Are you feeling dizziness? Are you feeling gut health issues like gas, bloating, constipation, diarrhea? Do you have skin rashes? Do you have extreme exhaustion? I mean, the list goes on and on and on. So what is it that you ladies are feeling right now? Thank you. I'm glad you love the analogy. I appreciate that. Hey, Michelle. Hey, Sandra and Christine. Great to see everybody today. Hello, Mel. If I miss somebody, I don't mean to. I'm trying to go back and see everybody that's here. So if I miss saying hi to you, my apologies. So you've got bloating, gas, brain fog, tired, weight gain, irritability. Yeah, Roseanne, you got a lot going on there. What about everybody else? Constipation, fatigue, brain fog, head pain. Yes, keep adding those comments in. I'm going to keep going so that we make sure we have enough time to cover everything, but I want to be able to see all the comments. Lower back pain, fatigue, joint pain, digestive issues, headaches. Yes, the list goes on and on. Sadness, anxiety, rashes, sinus pressure, joint pain, bloating, irritability. Yes, we do sound fun when we list out our symptoms, right? And trust me, when I had migraines, my list was going to be a lot longer than that. Neck pain, good one, joint pain. So we've talked about all these things that are kind of doom and gloom, right? You're probably all thinking right now, oh man, how many more years do I have before one of those things happens? But the good news is that there are ways to avoid or reduce chronic disease causing inflammation. There's so many ways to do it. There are scientifically proven ways that you can start reducing that chronic inflammation today. So before we touch on a few of those, I want to fully address what inflammation is, because I want to make sure that you all 100% understand what we're talking about. Hey, Cheryl, good to see you. Okay, so inflammation basically is just part of the body's immune response, and it is not always bad, okay? We're going to talk about acute inflammation and chronic inflammation. So when it's acute, it's not dangerous. We need acute inflammation. It's the body's natural defense against damaged cells, viruses, bacteria. In the Freedom from Migraine method, we call this green zone inflammation. It is when your body, I want you to think about your body having like these little soldiers. And when you cut your finger or you sprain your ankle, these little soldiers come out and they repair that area. If we didn't have that inflammatory process or those little soldiers, we would not be able to repair anything, right? So the body, through this inflammatory process, aims to remove the harmful or the foreign invaders and heal itself. So without this, again, wounds wouldn't heal, infections could be deadly. So when we're inflamed acutely, chemicals from white blood cells, they're released into the bloodstream or to that affected tissue to guard your body from the foreign substances and to work on repairs. Now, sometimes this release of chemicals, will increase that blood flow to the area or injury and infected area. And you can actually see with that heightened blood flow, sometimes you see visible redness, a feeling of warmth in the area, right? When you kind of cut your finger, you feel that, you see it get red and you feel it get warm. And this chemical release also can trigger like this little fluid leakage in the body, which causes the symptom of swelling. Now, nerves are also stimulated during this protective process, and this can lead to temporary pain. And that temporary pain is our body's way of telling us, you hurt this area, you need to be careful with it, you need to let it heal. So it's not that our body's being mean by causing pain, it's our body's way of telling us, okay, you got to baby this area. You got to focus on it, right? So think about that with migraines. What happens when we get a migraine? Do we always baby the migraine? Do we take care of the migraine? Or do we shove a pill in our mouth and push through? Throw an ice pack on our neck, strap it in and go to work. Put a heat pack on our neck and say, okay, I'm into the meeting now, right? Our body's talking to us. We have to remember that. Now, acute inflammation, it can start quickly, right? Because it's jumping in to take care of you, and it generally disappears pretty quickly. You know, it takes care of the problem and it leaves. Now, chronic inflammation can last for months or years or decades. And I'm going to say that there's a lot of women in this group that have had chronic inflammation for decades. Now, it might have started at a lower level. And again, we use colors. So we start at green, which is acute, and then we go to yellow, orange, and red. So many of you could have lived years at that yellow zone, so close to green. But the longer you have inflammation, the closer to that red zone you get. And when we get close to the red zone, then we are talking about the body breaking down and things like cancer, heart disease, Alzheimer's, diabetes. Those are the kind of things that we see in red zone. Orange, we're seeing things like autoimmunity, chronic migraines, you know, and some issues along that line. Yellow, you're typically feeling, I don't know, maybe some skin rashes, maybe some allergies, maybe a little asthma, you know, maybe quote unquote headaches and a migraine here or there. So you can see the progression in that. You know, the longer the chronic inflammation, the more inflamed you become, typically the increase in symptoms and making it worse. Now, for some of you right now who are saying, well, hey, you know, mine seem to have gotten a little bit better. Usually that's because you've done some things to reduce that inflammation. Like maybe you did change your diet up a little. Maybe you did start exercising a little. Again, that's where that roller coaster comes in, right? You know, we do a few things that are going to help it. And then the migraines didn't go away, so I'm going to stop doing those things. So then you take the nosedive. Now, I want to dive into chronic inflammation really quick, and I'm guessing we're going to be another 10 minutes here, ladies. So I know I told you 20 minutes for the training, but I'm trying to give you a little extra value. So hang in there with me, or if you can't, come back and make sure you watch this. It'll be live in the group. You can take a look later. So inflammation that persists longer than necessary is definitely going to start causing more harm than benefits. And we reference this through our migraine sensitivity scorecard that we have in this group, again, by using those green through the red zones to actually track your levels of inflammation. Now, if you have not heard of our migraine sensitivity scorecard before, please let Valentina know below right now by commenting zones, and she will ensure that you have access to our self-assessing quiz on your zone, and then the accompanied training to go with whatever score you have. So make sure you get that. We're not going to go too much into that today. I know we have another training on that somewhere in the group. Now, chronic inflammation is on the rise due to society's quickness to cover up symptoms versus getting to the root cause of them. This is the instant gratification. And sadly, our doctors have fallen into doing this in the conventional medicine world because we've actually kind of trained them to do so. We go to the doctor, we give them the symptoms, we tell them we want a quick fix. That quick fix, that quick cover up is medication. Most of us are not willing to do the work that it takes to actually get to the root cause. Plus, the doctors, yes, they make money off of every prescription that they write, and they do want you out of pain. They don't want you to be in pain, right? But what we need is a doctor that's going to say to us, here's a medication you're going to use temporarily, because yes, this will increase your inflammatory load when you take this. Yes, there are side effects to this medication that may not show up today, but side effects that may show up 20 years from now that you're not thinking about today. You're not thinking about the fact that, you know, you might be in a very sad state of health when you're in the prime of your life, you know, 60s, 70s, when you're not working anymore, you have this time you want to be traveling, you might be the sickest you've ever been because of consequences from things you're doing in your 30s, 40s, and 50s. Now, this instant gratification mentality is evident in society now because it's showing, and we can see our body's inability to fight things off. Not to go too far in the weeds with COVID, but let's stop to think about COVID and the impact that it has had on our society. If we did not have a society that was chronically inflamed, our bodies would be able to handle COVID more. Remember those little soldiers I was talking about? In acute inflammation, those soldiers come out, the inflammatory process, they work on the issue, and then they go rest. When you have chronic inflammation, those soldiers are working 24/7 on the chronic inflammation. If they're already fighting inflammation in your body, then COVID comes in, there aren't any soldiers left to do the fighting. So now some soldiers have to leave here and go over and fight COVID. And now there's only some soldiers left to fight the inflammation. So now we've split. And how well do you think we're going to do when that happens? So if you are someone that's extremely chronically inflamed and you get extremely ill from COVID, it's not necessarily the COVID per se that's made you ill. It's the way your body was before. So this goes the same for flus and colds and all of that. You know, our healthcare system is on the verge of crippling because of the increase in illness in our society. Now, symptoms of inflammation are going to be different depending on whether this is a acute or a chronic inflammation situation, right? So remember that acute inflammation, it often occurs because of an injury to an external body or skin. So things like, you know, sore throat due to a cold or flu, or, you know, COVID, you know, but again, remembering this can lead to chronic skin wounds, such as cuts, some type of physical trauma, like a concussion, bronchitis, sinus issues, rashes. You know, those are examples of when that acute is going to come out and really start working on the process. And you may notice symptoms like pain, redness, swelling, irritability, heat to the area, those kind of things. So those are the things that we think of with acute inflammation. Now, sometimes acute inflammation is going to occur deep within the body, such as like in an internal organ, like, you know, you're not going to be able to notice those signs. For example, if there's some issue with your lungs don't have sensory nerve endings nearby, so there may not be pain, even though there's inflammation present and your body works on that. But when we look at chronic instead, we're looking at different things. We're looking at different symptoms. So chronic, some symptoms that you're feeling are going to be fatigue, mouth sores, chest pain, fever, rashes, brain fog, joint pain, allergies, gut health issues, and we can't forget migraines. Chronic inflammation can affect every single organ in your body. So the worry isn't just migraine pain, you know, but long-term damage due to the damage to your organs, which we all know we need our organs to survive and live the long life that we want to. We do not want to put damage on those organs now so that later on in life, you know, when the inflammatory load in our body says enough is enough, we don't want to be those people that end up in, you know, the assisted living and the nursing home, unable to function, or worse, we don't want this to shorten our life, right? So even though it's hard to predict the future and see the future because we can't see inside, we have to know that when we have that symptom of migraine, our body is chronically inflamed, and that is the direction that we're headed. That is the direction that we're headed. So what is the main cause of inflammation in the body, right? There are actually several causes of chronic inflammation. And part of the problem when we focus on inflammation is we only focus on one area, right? Everybody wants to focus, just double checking in here. Everybody wants to focus on diet, right? That is the thing I hear the most, even when we bring wonderful ladies into the Freedom from Migraine method to work with us. The first thing everybody wants to focus on is diet. And while diet is a piece to the puzzle, there are many other pieces as well, which we're going to talk about right now. Now, medical experts, they point out some additional causes, and we're going to go through those, and then I'm going to go through how we focus on those. So one is your individual inflammatory response. If your body does not handle infection well with a normal acute or temporary inflammatory response, then you could end up with some out of control inflammation. You are then that person who needs to control your environment and lifestyle more to compensate for your increased level of inflammation. Now, this is not everyone, but typically when I see people that have chronic inflammation and they say they're doing everything right, that is typically that person. And there are ways to figure out how we can tweak and change their lifestyle just a little bit to be able to get them where they need to be. If you want an example of someone that we helped like this, please comment Connie below, and we will make sure that we tag you on a video for someone who fits this perfect example. So if you think you're that person, let us know Connie below, and we'll send you that information. Now, another issue is excessive weight or obesity. Extra fatty tissue produces these inflammatory cytokines in the body. And according to Dr. Dugan, a principal staff scientist at the Fred Hutchinson's Cancer Research Center in Seattle, being overweight can mean your body is in a state of long-term low-grade inflammation. So if you are carrying an extra 15, 20 pounds even, your body is actually in low-grade inflammation. Another is mood. Chronic stress actually changes gene activity in immune cells before they enter the bloodstream. This is information that was researched by Victoria Mays, who's an MD, the executive director at the University of the Arizona Center for Integrative Medicine in Tucson. There's also a suspected link between depression and increased blood levels of C-reactive proteins. If you've ever heard CRP, that's what we're talking about, which increases in response to inflammation. So often, again, people come into this group, they want to know what to eat, they want to know what meds to take, and we don't want to focus on our emotional side of our life. And when we don't, it can be a huge impact on our inflammation. I know you've heard me all say before that inflammatory food that stress can actually cause more inflammation than inflammatory food. And this is proving that right there. Another is personality traits. Research has actually shown that people that are less conscientious are more likely to have unhealthy habits that encourage inflammation, like smoking, eating unhealthy foods, avoidance to handling stress in their life, and moving less. Another big one is gut health. Having imbalanced gut bacteria can result in inflammation that can be behind digestive health concerns like irritable bowel syndrome, along with conditions outside of the digestive system. Problems with the microbiome can contribute to inflammatory conditions such as arthritis, depression, and neurological diseases. And this was researched at the Houston Methodist Hospital. And then one of the last ones that I want to mention is pollution exposure. Studies have shown a link between greater exposure to air pollution and higher levels of inflammation. There's so many things that we can take a look at and so many things that we can do on a daily basis to help with that exposure. Now, obviously, if we live next to a factory, we can't change that, but there's so many other things that we can do to reduce our toxic load, to be able to allow our body to handle any pollution that we cannot control. So in the Freedom from Migraine method, when we work with our private clients, and again, there are many different ways that we do this, but we have one main method that we follow. And in this method, our whole goal is to reduce inflammation. And there are 6 key areas that we focus on. We focus on electrolyte symmetry. We focus on nutrition integration. We focus on circadian responsivity, mindset modulation, movement stabilization, and toxicity mitigation, which cover all of the areas and more that I mentioned above. And only when we work on these 6 key areas can we actually tackle the chronic inflammation in our body. And when I see that women are struggling and women are not finding the lasting success that they want, it's when they decide that they only want to work on some of those areas because they feel they've already done the work in the others. How many of you watching this have had a conversation with me before and said, I've already tried it all. I've done it all. There's nothing you can tell me. Or you're talking about nutrition integration, but I've already changed my diet, so you can't help me in that area. How many of you said, well, I exercise, so it can't be my exercise that's the problem. Or I drink water, so it can't be my water that's an issue. How many of you have said that to me and then started working with us and realized There was a hell of a lot more I needed to learn. There really was more. Even though I did the thousands of hours of research, there really was more. I know there's somebody on right now. I actually think she just answered. Yes, Robin just answered. And I know that she felt that way for a very long time. And what's today? Thursday, Tuesday on our coaching call, the words that Robin had to share just after 2 weeks into the program really brought like half of the people on the call to tears. She has found her hope and started to find some amazing results just by really focusing on the inflammation in her body. Now, conventional medicine, what do they focus on? We all know what they focus on, right? Let's think about things like NSAIDs, right? Let's go take an aspirin. Let's take an ibuprofen. Let's take a Tylenol. Or worse, and I know some of you have done this, let's go take the steroids, right? Let's just go take the steroids. And all of you think that, of course, when you do those steroids, they do give you relief, right? They do give you some relief in the moment. But those steroids cause inflammation. They're giving you relief right now, but then guess what? They can cause osteoporosis, high blood pressure, diabetes, weight gain, increased vulnerability to infection, cataracts, glaucoma, what else? Muscle weakness, thinning of the skin, bruising easily. And all of those things are because of chronic inflammation. So what is that best anti-inflammatory medication? There isn't one. There is not one. Now, I am not telling you all right now to go out and stop taking what you're taking. Please do not do that. Everything that I'm talking about today is for educational purposes only. If you are going to make any changes to your life, you should consult your doctor first. But what I am saying to you is if you are taking a medication right now, you need to get to the root cause of your inflammation and end it so that you can as quickly as possible get off of that medication. And even if you're not taking a medication, you still need to get to the root of your migraines as quickly as possible because your body is screaming at you saying, you're inflamed. You are inflamed. That's why I'm giving you this migraine. And if you don't knock it off, it's going to be worse than a migraine later. You know, when you're 60, 70, 80, it's not going to be a migraine anymore. It's going to be cancer. It's going to be heart disease. It's going to be Alzheimer's. It's going to be a stroke. You know, whatever it may be for you later. So please remember those 6 key areas that I told you that we focus on, that we work on in all of our programs and in any way, shape, or form that we work with anyone. If you've done a challenge of mine, if you've done a masterclass of mine, if you've done a boot camp, if you've done anything, if you've been, you know, on a private coaching call with me, every single thing that we talk about is focusing on those 6 key areas to reduce that inflammation, to really start peeling those layers back. Like think of an onion. You know, you cannot get to the center of the onion. You have to, you know, without peeling the layers back. And that's exactly what we do is with each and every person that we work with, we peel back those layers to figure out, to get to that center and to be able to reduce the inflammation. We take you from whether you're red, orange, or yellow, we take you down to green. Okay, let me take a quick look at comments and then let's make sure we wrap this training up. My apologies for it taking so long, but I'm hoping that you all got a lot out of this and learned something that maybe you've heard a little bit about before, but I think it was important that you heard all aspects of it. So I'll try in the future to do something that's shorter, but I'm really not sure how to make this shorter because I think it was all super important to talk about. All right, I got to go back a little ways. I haven't looked at these comments in a while. Okay, so there we go. All treatments you've tried, and I've tried them all, give mid-relief at all, were short-lived. Exactly. Yes, Hashimoto's is an autoimmune condition. Absolutely. Hashimoto's, celiac, Graves' disease, Crohn's, all those kind of things, lupus, rheumatoid arthritis, type 2 diabetes is actually being classified as, type 1 diabetes is being classified as an autoimmune. Looks like a bunch of people are looking for the migraine sensitivity scorecard. That is great. So for those of you who have asked for anything today and you've asked Valentina to reach out to you, you need to make sure you go to your messenger in Facebook. And if you do not see a message from Valentina, it's sitting in your message request folder. So please go to your message request folder. If you don't know how to find that, just tag Valentina in the group. Just put a post in the group that says, hey, Valentina, I can't find the information that you're sending me, or click on her name in the group and send her a direct message and she will make sure to get it to you. because sometimes it does get hidden, and I want to make sure that you have that information. Okay, a couple people that want Connie's video. Perfect. We'll make sure that we get you tagged in that. Yeah, Nicole was definitely the research expert. Nicole is a nurse and researched massive amount of information, worked with us in the Freedom from Migraine method, and is just doing amazing. I love it. Yep, Robin tried, oh, I didn't know you tried steroids too, Robin. I probably did, but maybe I forgot that. Brenda, yes. Hey, Sue, how you doing? All right, does anybody have any quick, oops. I said Sue and Siri thought I was talking to her. Does anybody have any quick questions before we end our training today? Anything that I can answer for you? In the meantime, if anybody needs some support, if you are in this group and you're like, that is me, I am inflamed, I have migraines, I am done, I want to get off these meds, or even if you're not on meds, you know, when you're seeing the naturopath and you're going to the functional doctor and you're not getting the results, if you are ready, we have helped hundreds of women reduce their inflammation, get rid of all the symptoms they're feeling, and the happy side effect is you find your migraine freedom. So if you're ready to do that, then I want you to comment ready below, and Valentina will make sure she reaches out to you and sets you up with a quick call with a team member just to see where you're at. Let's see why. Let's see what's going on, and let's see if we can help. And I promise you, if I cannot help you, I will find somebody who can, because you don't have to do this anymore. You do not have to do this anymore. Go in guides 3, 4, 5, and 6 in this group and take a peek at the women, the thousands of testimonials of women who have changed their lives. They've done the work. We've provided the information, but they've done the work to change their lives. And not one of them has regret the time they put in there. All right, ladies, I don't see any more comments, but Freedom from Migraine Method is the best gift I've ever given yourself. I love that. So I'm sure there's going to be some more questions. I know there's going to be a bunch of people watching this on the replay. So please, if you have questions, feel free to tag myself or Valentina in this post, and we will make sure that we get back to you with all the answers. We'll keep an eye on this post for a couple days and make sure that we don't miss your comments. But if for some weird reason we do, because the group is pretty busy, just send us a private message. You know, that is probably the next best way to get a hold of us. Just, you know, click on our names in the group anywhere and just send us a private message and friend request us so that we can make sure that we can actually see each other's information a little bit easier. When Facebook knows we're friends, you're going to see more of our info, and go up there to notifications and mark that you get notified for every post that we put out, so you don't miss trainings like this, and so that you can see them live, so that you can participate with us, so that we can help you even better. Everyone, you are more than welcome. Thank you so much for being here. I appreciate it. Here's to your migraine-free day, and we'll see you in the group, everybody. Take care.